Hello, my name is Manish Arora. I'm Professor and Vice Chairman of Environmental Medicine and Climate Science at the Icahn School of Medicine at Mount Sinai. Maayan?
Hi, I'm Maayan Yitshak-Sade. I'm an epidemiologist and Associate Professor at the Department of Environmental Medicine and Climate Science at Mount Sinai.
So Maayan, it's wonderful to be here and thank you for taking the time to talk to us about your work. Would you like to start off by just describing what you do at Mount Sinai?
Sure. So I am an epidemiologist and I use big data and novel satellite-based exposure models to investigate how the environment affects our health, specifically cardiovascular health.
It sounds amazing. And when you say satellites, do you want to tell us a little bit more about how you use satellites? Because it seems almost like science fiction.
Yes, so we have the expertise in our department to use information from satellite images that we can then use to map exposures to air pollution, for example, and link these exposures to residential addresses going back years in time and see how these affected the people's risk for developing disease.
So when you say exposures, what all are you measuring and what are the conditions that you're studying?
So my focus is mainly on the consequences of climate change, air pollution exposure, for example. And I am specifically interested in heart disease because heart disease is the #1 killer in the United States, and so it's a major public health concern.
So when we think of climate change, we think of air pollution, we think of changes in temperature, just changes in so many aspects of our living environment. Who are the people who are most affected by this? Who are the people who should be most concerned?
So in many of our studies, we find that pregnant women, children, and older adults are more vulnerable to these environmental health effects. We also find that people of lower socioeconomic status and racial and ethnic minorities are more vulnerable. But I try to look at it from a slightly different angle and see how our environment can actually help us mitigate these environmental health effects. We have, for example, a study where we retrospectively follow World Trade Center responders to see if their exposure after 9/11 increased the risk for developing diabetes and hypertension, and whether their exposure in the 20 years later helped mitigating those risks. So if those who live in greener environments, cooler with better food options, somehow were able to mitigate this risk.
So that's very heartening to hear that you're looking not only at things that could make us sick, but you're also looking at things that could improve our wellness, improve our quality of life. So what advice would you have to those who are listening to us today about how to bring about change at an individual level so that we can be ready for any of the negative impacts of climate change?
So I think one of the most impactful thing of our research is that we study exposures that are modifiable, unlike genetics. But in diseases like diabetes or heart disease, when people want to reduce their risk, they often focus on behavioral risk factors. They'll quit smoking, they'll look at their diet, they often blame their disease on genetics. But if they simply consider environmental risks, it will be the first step to actually reduce their risk and limit their exposure for the extent that they can.
I think it's a wonderful overall message that we focus so much on something that cannot be changed, our genetics, and now that we can focus on something that we can change, our environment, it's an empowering message to everybody that we can be in charge of our own health. Finally, what I want is a bird's eye view of all the things that you and your colleagues are doing at Mount Sinai to really study the climate, and any last messages that you'd like to leave us with.
Sure. So in Mount Sinai, we have the Institute for Climate Change, Environmental Health, and Exposomics. And we have a very diverse group of researchers looking at the environment from different angles and how it affects our health. And more importantly, there's a very large emphasis on changing policy and making our research accessible to the community so we can actually make a change.
That's amazing. Thank you for taking the time to speak with me.
Sure. Thank you.